Welcome to the Ideagen Future of Global Summit, live here in Washington, D.C. I'm honored and privileged to have with me here today the incredible friend and leader of Ideagen and myself, Bill Novelli. Bill, welcome.
Thank you, George.
Also with us, the CEO of the AAPA, Lisa Gables. Lisa, welcome.
Thank you, George.
You know, changing the world is not easy, but somebody has to do it. And the both of you have done it in so many ways. And I'd like to start with you, Lisa. Would you kindly tell our global audience, the millions of people that are watching this program, what is it that you do at the AAPA, and what is your leadership style? How are you changing the world?
Well, thank you, George. I'm the CEO of the American Academy of Physician Associates, and I've been there about 12 years. And we are, as you probably are aware, PAs are medically trained healthcare clinicians who work in every specialty across every setting in healthcare and are changing the world themselves. It's one of the fastest growing professions. And it's been fun to work for this organization. And I would say that my leadership style over the years in the various roles that I've played in healthcare have been really one of transparency, accountability, and trust and respect of the people that work with me and for me. I think it's really the only way to do this. We're a team and we have to hit the marks, and that's how we do it.
Wow. What else can I say? That is leadership defined. When you open up the dictionary and you see leadership, Lisa's picture pops up. And that's what it is, leading the way. You are leading the way. So what significant initiatives are you working on currently? What are some that you just say, wake up in the morning and you say, wow, as we look out at Washington, D.C., what is inspiring you right now?
Yeah. Well, AAPA, of course, has a lot of strategies and things that we're working on. But I would say the top ones have to do with advocacy, change in state and federal policy that allow PAs to practice to the top of their own education and training, as well as be able to expand access to patient care. So that's a big one. I think the other thing we're doing, as I mentioned, we are a fast-growing profession, and we have a lot of students who are interested in becoming PAs. So we provide a lot of mentorship and training even before they've chosen to become a PA. So one of the interesting things we did was we pre-PA category of membership, and it's grown to over 5,000 members in about 2 years. So people are very interested. And the third thing that we're working on, and we'll talk, I think, a little bit more about this, is the broad-based initiative to tackle the problem of healthcare workforce shortage. The initiative really, PAs are leading the charge. As I just said, they're one of the fastest growing professions. So it's fitting that we at AAPA are leading the charge for this massive shortage of healthcare workers. And we're calling our initiative HealthForce.
Love that name. We're looking for the shirts and the hats that say HealthForce and some kind of uniform, perhaps.
Yes.
And it's exciting.
Yes, it is.
It's exciting on so many levels. I want to shout out back to Bill Novelli because, Bill, you're on the advisory board of Ideagen. You're a mentor. You're a leader. You were the CEO of AARP. You were the co-founder of Porter Novelli, one of the world's largest PR firms. You're at Georgetown's Business School. You've done so much and are doing so much. And now there's this HealthForce initiative that you're involved in. And so, in a few words, how are you helping to support this incredible mission of the HealthForce?
Well, Lisa's the leader of it. She and Leslie Crutchfield of our Business for Impact Center at Georgetown have really given birth to this thing. And my job, I think, is to help them. And the way I think about helping them is what they've conceived is if we're going to reform the American healthcare workforce, we need a movement. And so my job, I think, is going to be to help to create this movement, to make it work, to make it big, to make it strong, to make it effective.
You know, you talk about movements. What's striking to me is that, again, is you can't help but look out at Washington, D.C. and see all the monuments, the Capitol, the White House, Washington Monument, and you led Tobacco-Free Kids. I'm old enough to remember that. It wasn't so long ago. Tobacco-Free Kids, what a successful movement. And you utilize the power of youth in that movement, right? And the parents and everyone in the community said, tobacco-free kids, yeah, it made sense. And so how is that informing your support of this HealthForce?
Well, the campaign for tobacco-free kids was a success. But I think if you go back to the early days, what we had was an epidemic. Kid smoking was at an all-time high. We had to do something about it. It got everybody's attention. This is the way the American healthcare workforce is today. I mean, it is in crisis. It's all kinds of shortages. It's burnout. It's lack of faculty to do the teaching to replace people who are leaving the workforce. So we have a rapidly aging population. We've got all kinds of problems with the American workforce, the American healthcare system. And so workforce is predominant among them. So here again, we have an epidemic, and we've got to basically address it, and we've got to take advantage of it.
That's right. That's right. And so what do you both see as the greatest issues within this pipeline issue, the healthcare pipeline issue? What do you see as the paramount concern, and how do you address it?
Well, there are quite a number of concerns. Clearly, our healthcare system has some issues. All right. I think the biggest way I've been thinking about this for many years is actually the problem that Bill mentioned. We've got people leaving the healthcare workforce, but not enough people coming in to replace them.
Yeah.
So we are tackling the barriers to entry all the way down at the K through 12 level and going forward. So it's not looking at necessarily the payer systems yet. It's not looking at the convoluted way in which we have our insurance strategies here in the US, but it's really looking at this issue of literal people to come into the system, and how do we get them engaged? How do we teach them? You know, it's not just doctors and nurses. There's a whole plethora of healthcare jobs out there for you. So that's really what I would say is one of the biggest strategies and ways and challenges we face is getting people to be aware, kids to be aware that they may have an option to go forward.
Yeah, and you know, George, I think it's really key that people in the healthcare workforce, they get up and they go to work in the morning to help patients. This is what they do. And this is what they want to do. And we have to help them to do a better job of doing it. So I think the way Lisa's conceived this is put the patients at the center. And if we do that, I think we're going to make a lot of progress.
That's right, Bill. You're absolutely right. Lisa, thank you for looking at it in those terms.
Yeah, one other point about this, and I think it's important for your viewers to hear this. This movement is about all healthcare licensed professionals. All. It's really intended to be ubiquitous when it comes to looking at the whole, because we need everyone. We need everyone helping us. So it isn't just about one, like I work for AAPA. It's not just about PAs. It's about the whole. So I just want to make that
That's
clear.
a good point. Good point. You can't do it alone.
Yeah.
It can't be done alone, and you need a movement. And that's what Bill's contribution here. He's done it before. He started movements. He's still starting movements, and effective ones at that. And so in what ways is the AAPA or HealthForce and the HealthForce working to address these gaps, particularly in terms of education and practice rights?
Yeah, so we have basically a model that addresses 5 areas. One is, I mentioned the K through 12 awareness piece. It's bringing awareness to young children through innovative uses. So things like gaming, or in schools, or even prior to school, in preschool, introducing them to ideas that maybe they hadn't really thought about unless their parents perhaps were in the healthcare field. The second piece is, once you get awareness of this, you get into maybe middle school or high school, and you're thinking about maybe becoming a healthcare professional, but you start looking around at the high cost of education, and you say, whoa, I can't do this. This is too burdensome. So we've got to deal with the high cost of education, higher education for healthcare workers of all kinds. Then let's say you were able to get a scholarship and you can figure out your financing to go. Then you get into school, and the problem that Bill talked about, there's a faculty shortage, and there are preceptorship and residency shortages. So we've got to deal with that problem. Then let's say you make it all the way through school and you're out there in the workforce now, Now we're starting to see problems of pay gaps. We're seeing problems of state law that don't allow certain practitioners to practice to the top of their own education and training, or other barriers that cause problems. And then the last piece of this is burnout. We hear this all the time. People are leaving the healthcare profession in droves. I mean, the pipeline is such that there are more people exiting out the end of the pipeline than there are coming in. And a lot of the reason is burnout. COVID really precipitated that, but it's been going on for a long time. So we've got to address that whole entire spectrum.
So would you consider those the challenges, and then what are the opportunities?
So the challenges, those are a few of the challenges. The opportunities are, I think we can do it.
Yeah.
And George, I think it's been phenomenal that with Bill's help, we've been talking to people all over the country.
Yeah.
All kinds of people in healthcare, people outside of healthcare, and people want to help. I have not had one person say, no, this is not a problem. We've got this, nobody is saying that. So the opportunity is there's a room for everyone to help with this movement, even the 5-year-old child.
Incredible.
Yeah, and if you add up all the problems that she's enumerated, it is an enormous issue. It's an enormous problem. And so if we're going to tackle it, we've got to tackle it in a big way. We need policy work, policy advocacy. We need grassroots work. We need systems change. We've got to get everybody at the table. That's the only way we're going to win this.
Yeah.
Well, and you've got the global aging population, you've got
Yes.
caretakers, you've got disease, Alzheimer's is one we talked about earlier
Yes.
today. I mean, there's so many different things.
Right.
And so addressing it takes, I believe that one person can change the world. Lisa Gables, you are changing the world. Bill, you've changed it in so many ways, and together, forget it. It's over. Game over. We're going to fix this.
Game over.
Thank you so very
Thanks,
much.
George.
Thank you, Bill.
George, a pleasure.